breast reduction and then implants. So this is a patient who's inquired who says they want to have their breasts smaller, but they want them to be fuller. And this is a bit like what Olivia is saying. They want them to be fuller in the upper part, and they want that sort of look, but they want them to be smaller. Now, what I normally say is implants make them bigger. A lift slash reduction, we'll call a lift and reduction the same thing, make the shape better. So if you're doing stuff for the shape, you need a lift. If you're doing stuff for the size, you need implants. So in terms of if you want to make them bigger, that's the bottom line of it. So if you're saying I want to be smaller, initially I'm thinking, well, don't do implants then, because implants make them bigger. But I can understand where this patient's coming from, but because the implants give more fullness in the upper part of the breast. And if you want to have sustained fullness in the upper part of the breast, that is what implants do. When you do a lift or a breast reduction, the breasts are lifted and then they settle to get what I would call a more natural look. And this is something about you have to be informed before you go down the route of surgery, because if you have to be prepared of what a breast looks like without implants. And that is a natural breast. It does tend to settle with a concavity in the upper pole. Now, in a bra, you can push them up and do whatever you want in a bra, but when you take your bra off, they will settle. And some people will put in implants, will reduce you smaller, and then put in implants in order to give you that shape. It's not really something I like to do. It's not really something I particularly think is a good thing to do. I don't think it's good to take out healthy natural breast and then replace it with implant, because implants have got potential complications and all sorts of things. And so you don't really want to have implants unless you really need them. And I think implants are really good if you want to be bigger. Excuse me. But they're not so good. And I would query using them just for shape. Personally, that's a personal opinion. I know I went to a meeting a couple of years ago. There's a guy from South America who presented this technique, and he obviously thinks it's good and very well respected surgeon. So I'm not saying it's a bad thing, but it's something that I feel a little bit uncomfortable with personally, because I don't like the thought of doing a reduction and then putting implants in.